Welcome everyone. Thank you for checking out this video. This video is prepared by the NCDA International Student Services Committee social media team. In this video, our goal is to bring attention to the importance of mental health issues among international students and how career service professionals can address these issues when working with students. Before we get started, let me introduce the team who prepared this video. My name is Vivi Hua. I'm a clinical psychologist and a coach for international student success. After completing my undergrad in Taiwan, I came to the US in 2006 to pursue my training in school and clinical child psychology. I've mentored international students in grad school as well as worked with international students in psychotherapy and coaching for close to 15 years. I joined the social media team of NCDA ISSC in 2021.
My name is Elif Balın. I'm a licensed professional counselor specialized in career counseling and counselor education. As a former international student myself and a long-term member of our NCDA committee, I'm a passionate advocate for international student career development and well-being.
My name is Maggie Luo. I'm a career counselor with more than 6 years of experience serving international students. I came to the United States as an international student myself, and I'm passionate about helping international students succeed in the US. I joined the social media team of NCDA ISSC since 2019.
First of all, I would like to define some key terms for this video. They are mental health, career development, and career counseling. Mental health. According to American Psychological Association, mental health is a state of mind characterized by emotional well-being, good behavioral adjustment, relative freedom from anxiety and disabling symptoms, as well as a capacity to establish constructive relationships and cope with the ordinary demands and stressors of life. Career development and work. The quotes are included here to highlight the evolvement of the concept of career development and work. As you can see, these definitions are closely tied to the greater socioeconomic context of different times. For example, some of the definitions in recent years include the definition of work as an essential aspect of optimal human functioning and wellness. Unemployment, worker mental health, work-family interface, and employment disparities are among some of the closely related impacts of the COVID-19 pandemic. To the definition by NCDA, career counseling provides the opportunity for a deeper level of involvement with the client, based on the establishment of a professional counseling relationship and the potential for assisting clients with career and personal development concerns that are beyond those included in career planning. While career counseling can provide more context and time to address mental health, other career development services, such as brief coaching or consultation services about interview preparation, CV creation, for example, may also provide some clues for practitioners to explore their clients' well-being and possible needs.
Let's begin with some questions to think why we talk about mental health in relation to supporting international student career development. Ask yourself and remember, there is no right or wrong answer. It's just a reflection from your past service. We encourage you to pause this video and take a few minutes to reflect on these questions. We all have diverse personal, cultural, and professional backgrounds that may impact how we define and address mental health needs. For a deeper and collaboration reflection, you may also discuss these questions with your colleagues, friends, or family to hear more diverse perspectives before we share in this video. What is the role of mental health in international student career development, such as transition to studies in the US, job internship search, or work experiences? What are the ways that mental health needs show up during your services? How do you respond to students' verbal and nonverbal cues of potential mental health risks during your services? How may your response be impacted by your cultural identities and values, your professional identity and training, job title, job responsibilities, and workplace structure. Why should we consider mental health while supporting international students' career development? Exploring career development and counseling needs in relation to overall client well-being, including mental health, is an ethical responsibility. Beneficence or working for the good of the individual and society by promoting mental health and well-being, according to NCDA Code of Ethics, as well as a practice of cultural competence and advocacy. Identify and select techniques and appropriate to client or group goals and client needs. Psychological states and development tasks identify and understand social contextual conditions affecting clients' careers. Does this apply to all career development practitioners? We are all responsible for recognizing and considering the impact of mental health in career development and planning. However, we will address them in different ways depending on our training, skills, and resources. Career development professionals must only perform activities for which they possess or have access to the necessary skills and resources for giving the kind of help that is needed, according to NCDA and ACA ethical standards. If a professional does not have the appropriate training or resources for the type of career concern presented, an appropriate referral must be made. No person should attempt to use these skills for which he or she has not been trained.
Mental health issues are among the fastest growing public health crises in the United States and around the world, and they should be addressed for all individuals and communities everywhere. The counseling and psychology fields, along with other scholarship, have long proved that we can't separate personal and career issues. They impact each other. For example, unemployment and underemployment threaten mental health besides other issues of decent work or the lack of it in people's lives. Unemployment associated with negative mental health outcomes such as anxiety, depression, low self-esteem. And these effects may be stronger for vulnerable workers such as those from developing nations, which some international students are from or return to. The research also shows that job insecurity may be just as harmful to mental health as unemployment and is consistently linked with increases in depression and anxiety. Due to several systemic and cultural barriers to job search, such as employer bias or their misconceptions about work authorization and work visa applications, unemployment, underemployment, and job insecurity are among the most frequently reported areas of concerns for international students, and they have the potential to impact their mental health. Cultural transition-related experiences may further challenge both career development and mental health. One literature-based example is acculturative stress. Acculturation is the process that international students experience cultural and psychological changes when they integrate with two or more groups of different cultures. Being away from one's family, friends, homeland, and other acculturation experiences may be challenging. Acculturative stress may emerge from these experiences, and it may also show up as alienation, depression, anxiety, marginalization, heightened psychosomatic symptoms, for example, headaches or insomnia, as well as identity confusion. In practice, we need to define and explore acculturation or other cultural experiences in the context of each unique student, as their intersectional identities and social or systemic circumstances will shape the duration and diversity of their cultural transition experiences. Acculturative stress is found to be associated with lower levels of career outcome expectations, and those with greater intercultural competence concerns tend to have lower career aspirations and lower career outcome expectations. Increased psychological distress also predicted higher levels of career indecision, which in turn was linked with lower career uncertainty. Given what we know from the literature, some of which we just highlighted, career development professionals should be better recognized and equipped as critical frontline professionals who may observe mental health-related needs of international students. Similarly, counselors in mental health settings should also explore work or career development-related risk factors and needs that may accompany other issues. On the other hand, some research shows us that international students might actually be less likely than domestic students to seek mental health support. And the research in this area has a limited scope. Also, several surveys, such as those from our NCDA committee and World Education Services, show that international students have limited awareness of and satisfaction with career services, besides using these services closer to graduation. So, what does all of this say to us? Overall, reaching out to students earlier, when cultural transition stress first emerges, for example, and providing proactive, expert career development by informing and empowering them against the systemic barriers and other risk factors can be effective and preventative mental health support strategies for international students.
Next video, we'll be discussing skills and strategies career counselors can develop in order to build relationships with international students, become more aware of students' emotional needs, and help them approach career development with greater confidence.
That's the end of today's video. Learn more about the committee and find resources by visiting ncda.org. Join our LinkedIn group, NCDA International Student Career Development Professionals. If you like this video, please subscribe to our channel and share it with friends and colleagues that you work with. See you in the next one.